Hey everyone, in today's episode, we're talking about the actual hard medical math behind Thomas's cancer journey, the danger of staring at a bleak prognosis, and really the incredible science of something called psychoneuroimmunology, how your thoughts and words impact your immune system's ability to fight. So let's get started. So last week, we were sitting at the Ben Cancer Center with Thomas's local oncologist, and we were really reflecting on everything that's happened, from his leukemia diagnosis to the relapse around his brain and spine after his transplant. And we were sitting down and doing this because he was reviewing Thomas's most recent results, which we kind of said very briefly last week, of the fact that he is totally clear from cancer in his cerebral spinal fluid. It's been a year, which is a huge, huge milestone. And so it was great because your provider was very animated.
Yeah.
It's like, I don't think you understand.
So excited. Yeah.
He was thrilled. He's like, I don't think you guys understand how big of a deal this is. He was framing it very positively. He wasn't saying just how bleak things were. He was just trying to highlight to us how much gratitude and just how amazing it is that Thomas is here today and that things have gone so well. He called it, what did he call it? A home run?
Yeah, they hit a home run.
Yes, OHSU has been phenomenal, as has St. Charles here in Bend. They've been working really well together. He was in a fantastic mood and just celebrating with us.
Yeah, and he really did pull back the curtain and confirmed just how exceptionally rare my particular situation was and how statistically significant my survival was. The real numbers are way worse than we originally thought. And I'm glad I didn't know that during the peak of my cancer battle. It's
very good. Thank you to our transplant doctor who did not share all these things with us.
Yes,
the day after Christmas when we were grappling with the diagnosis.
Yeah, sometimes it's helpful to know that stuff. Sometimes it's really not.
Yeah.
And so I purposefully, over the course of my cancer battle, didn't hop on the internet and Google things and read the likelihood of my prognosis and one way or another. I just knew it wouldn't be helpful. It wasn't going to change treatment or how I was to go forward, other than it maybe just bumming me out.
So we did an AI deep dive of those true medical statistics, along with talking to his Ben doctor and OHSU doctor. And today we want to share the math of the miracle, so to speak, with you. And we're really not sharing this to focus on the trauma, but we're sharing this because that we know so many of our listeners have been handed a terrifying diagnosis or prognosis. And we want to show you how to find hope when those numbers are scary and maybe they indicate that there shouldn't be a lot of hope. We want to walk with you and share with you what our journey was like. So should we start at the beginning?
It's a very good place to start.
I will not sing the song. I will spare our listeners.
It's a Sound of Music reference to those who are like, what are they talking about?
So chapter 1, this is the check engine light and the diagnosis, if we are going to give it chapters.
Yeah, why not? Okay. Organization's good. So our journey starts with the check engine light. So back in June of 2024, I had a minor cut on my finger that just wouldn't heal.
And it wasn't even a cut. It was almost like when you have dry hands and you have a little crack.
A little crack in my skin. And it just started looking gnarlier and gnarlier as time went on.
And you didn't think too much of it.
No, I just put some Neosporin and a Band-Aid on it and kind of just kept going back to work and doing my thing. I really wasn't worried about it whatsoever. I'd also been kind of feeling a little dizzy at that time, and I happened to mention that to Lindsay kind of offhanded. But anyways, my finger kept getting so gnarly that we decided to go to the ER actually to get it looked at. It was like purple and necrose.
Should we put a picture? I don't think we should put a picture on our YouTube video.
No.
Nah.
It's pretty obscene for a finger.
So it was just a yucky looking finger. And there's a book called, I think it's called You Better Not Die or I'll Kill You. It's really funny. It's like a wife's story of going through her husband's medical journey. And she's like actually a comedian. And anyway, she just brings a lot of humor, but she also interviews a variety of medical professionals and other, spouses or cancer survivors and gets people's opinions. And there was one ER doctor, and she had said, nagging wives save lives. And her rule was, I guess the rule kind of sounds a little
sexist. It's true in my case.
She said, never allow a man to go to the ER without a sister, wife, or like female neighbor friend to help keep them on track and accurately describe their medical profile.
That we're poor historians left by ourselves, apparently. It was like, it's fine. How you doing? Good.
He was connected to a pain pump and like could hardly talk. And they're like, how's it going this morning? Which, his rounding team in the hospital, always an interesting question to start off with when you have a patient who's on the verge of being intubated. And Thomas always started it with like, thumbs up, all good over here, doc.
Doing great. Yeah.
So by the way, if you are someone who is with a loved one, regardless of gender, and they maybe are really highlighting how well they're doing, pausing as the loved one instead of interjecting, which I did so many times of like, actually, you can't talk. Actually, just I've learned to wait until people are done talking. The doctors will go around and usually they'll say in Lindsay or to the other family member, so what is your experience or what is your perspective on how things have been? And if they don't, maybe at the get-go, you could say, oh, I'd like to provide my insight. When would that be helpful? And then either you're able to interject it or they'll say, oh, at the end, tell us. Or maybe they want to have the caregiver kick it off with their information. So you'll find your flow. But if I could go back and tell my younger self to not be so unsettled by your appraisal, your articulation of your appraisal to the team. Yeah. Anyway, nagging wives save lives. I brought Thomas to the ER because of a finger cut.
Yep. Saved my life.
So we're in the ER and they're looking at his finger and like, wow, that does not look very good. But they did an x-ray. The x-ray came back fine. And then they were getting ready to send Thomas out with like an antibiotic or some kind of cream. They were getting ready to send him on his way.
Right.
And I mentioned, oh, yeah, by the way, he's been a little bit dizzy when he stands up from the couch sometimes. It's kind of like an offhanded dizzy comment. And your ER doctor was really cool that day. He was a bro and, just like, what's going on? And I don't know, he just had this really chill vibe to him. Yeah. And so he's like, okay, we'll run a CBC, a complete blood count on you. And then he left and they got the labs. And then when he came back, this was not the same chill ER doctor. He was like looking somber and he pulled a chair up. By the way, we were in the middle of the hallway of the ER because it was so full.
Rooms, yeah.
There were no rooms at the inn. It was very full. We're in this little gurney. We can show a picture of that because you can't see the finger very well. So I'll put a picture on YouTube. But we're in the hallway and the doctor came back looking a lot less chill than he did previously. And he said, your blood counts look like someone who's on chemotherapy. Are you on chemotherapy? And Thomas was like, no. We had been cleaning his mom's apartment. And she was on chemo. So we were like, we're helping take care of someone who's
maybe that's it. Maybe I've been exposed to something like that.
We really didn't know. And he said, no, this would be like if you were in active cancer treatment. And so he said the labs are either indicating that you have a cancer or there's some kind of, autoimmune issue going on, but we're going to have you go to the Bank Cancer Center tomorrow. And I said, oh, well, I'll probably need to call and make an appointment. And he's like, we're fitting you in. You'll be in tomorrow at 8.
We already made you an appointment.
Yes.
It's tomorrow at 9.
And having taken care of Thomas's mom's appointments, I would make her a cancer center appointment since she had a terminal diagnosis of pancreatic cancer and was getting treated there. I knew how long it took to get an appointment and how you'd have to try to get on the books. And the fact that they said they already had one for us, that was such a wild moment. Like when he said that you either have cancer and having just been given that shocking news 3 months earlier that your mom had cancer, like out of left field, then to have a doctor say, looking at my husband, Thomas, saying, you might have cancer. Like everything was in slow motion. And I remember looking across the hall because we were in the hall, but there were 2 rooms. One had a 2 over it. One had a 3. And it said, I saw the number 23 and that made me think of Psalm 23, which provided some comfort. And just one piece there. I know this isn't on our notes, but just, it says, even though I walk through the valley of the shadow of death, I will fear no evil. So I was pausing. I took a breath and I said that little scripture. I'm not good at memorizing scripture, but I tried to piece some of it together, but just, this is really hard. I have no idea what's happening, but I just asked for God to be there with me.
Yeah. In moments like that, that's, all you can do really, So I went to the appointment the next morning and had a bone marrow biopsy and it revealed that, I indeed had leukemia cells in my bone marrow. And it showed a pretty high percentage of leukemia because the leukemia burden rapidly suppresses your healthy blood cells. The life expectancy for untreated patients at that stage is measured in weeks, if not days. And so if I hadn't gone to the ER for that finger cut, I probably wouldn't have lasted a month.
Which is so shocking.
Yeah.
So they revealed that through the bone marrow biopsy, which you did not have any sedation for.
Right.
Sober as a judge.
Yep. They just bent me over a table and drilled into I guess they didn't drill, they hammered into my hip bone.
Yep. They use drills in OHSU. That's an upgrade.
None of it's fun.
I had brought your aunt along with us for the appointment, even though I thought, oh, it's probably an autoimmune thing. Just having her there, I wanted to have another person listening in. And she was so helpful. Jen and I stepped outside of the room after the doctor had shared just the initial results. And I just collapsed. Like I was just crying, like sobbing, and Jen was holding me. And the doctor had told us that we needed to get to OHSU right away. And I had said, well, why can't he be treated here in Bend? Because, we're here a lot of days a week with Thomas's mom. Like we know the Bend Cancer Center is amazing.
We know the cancer center. We come here all the time.
We're regulars.
Right.
We have a punch card and everything. But she explained that the diagnosis itself, the type of cancer he had, was extremely rare. It was Mixed Phenotype Acute Leukemia. So MPAL is the little acronym. And if a normal blood cancer is a forest fire, so to speak, like acute leukemias are usually pretty aggressive, MPAL is like a rapidly burning fire with two completely different types of fuel. So it has the AML, acute myeloid leukemia, and it also has ALL, acute lymphoblastic leukemia. So MPAL is both of the acute leukemias into one.
All the above.
All the above. We were interviewed on the Blood Cancer United podcast, and the gal who interviewed us was amazing. And she came up with the little, it's like they're pals. MPAL, AML and AML are walking down the street and they're pals. I like that.
Nice.
Not like our forest fire analogy.
No.
A little more, a little cuter.
A little more cute.
Yeah. But if we were to equate this to a forest fire, it would be like, two different types of fuel, and the doctors have to kind of guess or look at different literature as to which chemical foam will actually put out the fire, so to speak. And for Thomas, they did it from a acute lymphoblastic leukemia or ALL pediatric regimen. So he has an incredible medical team. They hit a home run at OHSU as well as Bend, and they started out saying, okay, let's target the ALL, that type of fire. And then when that didn't work, we had to pivot and start over basically. But it wasn't just the leukemia that was an issue. There was also a genetic component that was really challenging.
So to make it worse, further testing revealed I also carried something called the GATA2 mutation. And in the forest fire analogy, GATA2 meant that the trees in my bone marrow were literally soaked in gasoline. I didn't just need the fire to be put out, like I needed an entirely new forest.
Yeah. GATA2 is something that is very rare. It's like, I think 1 in a million, literally, in the population will have GATA2. Some hematologists, not at major centers, but in other hospitals, some hematologists will never even see a GATA2 patient in their career. So pretty rare. And the situation with this is that GATA2, I was looking a little bit more into it recently. It's really sneaky. It is a blueprint for how to hide. That's why GATA2 is hard with chemotherapy, because it programs the cancer cells to be able to escape. Like, oh, here's how you dodge, this type of chemo. Like it's
a little escape plan.
It's like in the van outside the jewelry shop that's being heisted. I don't know. We're going to have a lot of analogies in here. Way too many. We'll have an analogy counter in the corner of the video.
Just love a good analogy.
So anyway, GATA2, not something that you want. So MPAL accounts for only 2 to 5% of acute leukemias, around the 1 to 3% mark of all leukemias as a whole. That GATA2 mutation, again, roughly 1 in a million. After Thomas had done his first round of cancer treatment, you called it, what was it, cancer pajama pants camp or something, summer camp?
Yeah, I think it was for my brother that I came up with that. I didn't want him to worry about me. Like our mom had just got diagnosed with cancer.
That was hard.
And so I was trying to downplay, and I was like, hey man, I'm going to be staying in Portland, which is where he lives. I'm going to be at OHSU for like a month, and it'll be an inpatient. It looks really nice though. It's going to be kind of like going to summer camp, except there's just more drugs and
expensive drugs.
Yeah. So it'll be, Lindsay will be with me. We'll, make it a good time, whatever, it's all right. Feel free to come visit me. But yeah, nothing to worry about though,
One of the unique situations is that people in our family were all oriented towards Julie's cancer. And it was only 3 months in, so we were all kind of grappling with that and figuring out, schedules for who was taking her to infusion for her chemo. And then when we got your cancer diagnosis, breaking the news to people was so devastating because people didn't believe it. It was really really hard for people. And so I think both of us tried to word it in a way that would make it a little more, I guess, easier for people to handle.
Palatable, yeah.
Yeah. But when you said you're going to, chemo summer camp, people still knew it was going to be hard. After, I think it was about 6 grueling weeks of chemotherapy, I lived in the hospital with him in his room. We were told that his bone marrow biopsy came back. It was clean. It worked. We're going to get you out of here. We were so excited. But then a few days later, the final results came back, and that's what revealed he still had leukemia. There was 1%. We thought, hey, 1% is not that bad, but it wasn't just that. It was also, there was that GATA2. And with the amount of chemo he got, there shouldn't have been 1%. They broke the news to us that you actually weren't in full remission. We had already told the whole family, hey, everyone, no need to worry. Summer camp worked. But unfortunately, we did get that news. There was a lower level of cancer, very small, but present, and that the GATA2 was there. And so they told us that if Thomas had been on continuous chemotherapy treatments, like nonstop, continuing on with chemo, he had a 30% chance of survival, even with that. But if he were to have a bone marrow transplant, something they call an allogenic bone marrow transplant, meaning it's coming from a different donor, a different person, then that brought him to about a 60% chance. And so we like those odds. It made it a little bit easier of a decision. It was like 30%, 60%. 60% still wasn't, the statistics I would have liked to have heard.
Right.
But
sure.
It was a lot better than 30. So even though he went through all that chemo, that grueling treatment, we knew, okay, didn't work. So now the quest started of looking for a donor. So we invited Thomas's brother, Nick. This is part 2, chapter 2, finding his donor and the transplant. So we went through, that time in the hospital, and then the search began for a donor. The first thing they do is they have someone who needs a transplant. They have their siblings get tested, but unfortunately he was not a match. And we called it the Great Burrito Bribe of 2024.
We lured him to the hospital with breakfast burritos.
Yes.
Like, hey, you mind getting tested for bone marrow? And it's not as grueling as it sounds. They just take a little blood sample. We made sure he was happy with his burrito, and then we asked him.
Halfway through the burrito, and it was, okay, so we have another request. How would you be willing to be a donor? And he was like, right away, boom.
Yeah,
I got you, bro. Yeah. But when we found out that he was not a match, then they had to do basically a global search. They looked through a registry of people who had been registered as donors. And then we had a ray of hope.
Yeah, from Germany of all places. And
yeah.
You know Olga, we've talked about her many a time, but she was my 10 out of 12 genetic match. And she's a 21-year-old donor, hadn't had kids yet, which is important for your immune system not attacking you. But even just getting her cells into my body was a miracle. There's a major issue with the shipment of her stem cells.
Yes.
They were delayed in transit from Germany to Portland. And with stem cells, every single passing hour means they effectively become less effective. So we were literally watching the clock. They finally arrived just inside the window for them to be usable. But it made us quite anxious, to say the least.
It did. It was definitely concerning not knowing where the stem cells were when they got to a point where they're like, there's been a delay. We can't quite pinpoint where they are. But the rounding doctor was awesome. And she assured us, hey, you know what? If they're 48 hours late, that's still within the window. They're not quite as effective, but it's going to be okay. And then as she came back for the next set of rounds, and she's like, well, there's a study in Australia that showed that 72 hours, technically there was some viability there.
Did I say 48? I meant 72.
But it's true. She was providing context. 72 hours was, in fact, there was data there. But again, 24 hours, that's a lot better. But thankfully, they came just in the nick of time. You went through the transplant.
Yeah.
And we thought that the worst was over.
Which brings us to chapter 3, the relapse.
So fast forward to about day 60, which is Christmas Day of 2024. And we got the devastating news that Thomas's leukemia had returned and it had crossed the blood-brain barrier. This is extremely rare. They don't anticipate relapses of this nature. And so it was very shocking and really discouraging.
Yeah, especially with all that had gone on before. I mean, it was pretty hardcore, the regimen I was on and went through.
Radiation.
Yeah, full body radiation, chemo.
Before transplant, to make sure that transplant was as successful as possible.
Yeah.
And so even though he did, they call it total body irradiation, myoablative conditioning, it's like as intense as it gets. Even with all of that, he still had a relapse. The cancer was hiding in that delicate cerebral spinal fluid around the brain and spine. Standard IV chemo couldn't reach it. It needed a highly specialized team of spinal chemo and brain radiation. The typical chemo with the IV, it's not going to reach the cancer in his spinal fluid around his brain. It just can't cross that blood-brain barrier.
So the day after Christmas, when we met with my oncologist at OHSU, she told us this relapse impacted my survival odds, but with the targeted treatment, we could achieve remission, and that being the craniospinal radiation you were talking about.
And intrathecal chemotherapy, which is where they would inject chemo by way of an epidural into his spine twice a week for several weeks.
Upon research, we learned a myeloid central nervous system relapse following a transplant, like I went through, is a clinical anomaly occurring in only 1 to 4% of all AML transplant patients. But because my relapse happened at day 56 before the critical 100-day milestone, it's classified as a very early refractory relapse. The actual survival statistics for a day 56 CNS relapse actually drop into the single digits and are historically cited as less than 5%. So,
very happy that we did not know that.
Happy I didn't know that.
Yes. So the battle waged on. Thomas had that treatment. Julie was there with us, like we mentioned in our last episode, traveling up the mountain with Thomas every day as he got that radiation. And then we were celebrating. He rang the radiation bell when he completed his treatment. He got another lumbar puncture showing that the cancer was gone from the central nervous system. That was phenomenal news. However, he had a bone marrow biopsy, and that revealed that GATA2, that sneaky little genetic marker, had come back. And so, he wasn't fully engrafted. There was Olga's cells, but there was still host. They call it donor cells and host cells. And of the cells that were remaining in his system, they were the GATA2 ones were showing up there. And so although that isn't a full relapse technically, it could be categorized as like a molecular one.
Right.
Those GATA2 guys were coming back. And as we've mentioned, they have the propensity to multiply cells and have cancer be recurring.
Yeah. Our relapse was basically imminent if
Exactly.
we didn't do anything.
And again, at the time, we didn't know that. His doctor was great. She's like, oh, GATA2's come back, but we're going to have a secondary transplant. And we reached out to your donor and she said, yes, she'll do it again. And so I was just kind of like, okay. Like, I didn't realize GATA2 recurrence is technically a molecular situation that's really not good. Anyway, they reached out to Olga. She was willing to do another transplant or another stem cell collection, which is incredible. But, getting the stem cell collection, everything in line, it takes time. And it was time at that point that we really didn't have.
So we needed the donor cells that were already inside me to wake up and start fighting like immediately.
That was a faster solution.
Right. Yeah. So the doctors did a tacrolimus poll.
Which is not a wrestling move.
Not a wrestling move. But it's when they drop my immunosuppressants called tacrolimus.
We have a tacrolimus song, which will not be sung on
we won't
this
sing
episode.
It for you, maybe someday.
It was the song that we would sing as I would give the medicine to you. Like if it was early in the morning or you were already asleep, I would sing your little tacrolimus song.
Tacrolimus time is tacrolimus time.
And we did sing it. We'll probably cut that out.
So they stopped my immunosuppressants to spark graft versus leukemia.
Or GVL.
GVL. Essentially taking the leashes off of an untrained security force in me, those donor cells, and hoping the donor cells would kill the cancer before they had destroyed my own organs.
Right. And luckily, all that the GVHD that we saw, and I shouldn't say all that because it was still very uncomfortable and very hard, was graft versus host disease, or GVHD, of the skin, eyes, and mouth. But it didn't reach his liver. It didn't go to his lungs. It worked. It took out all the GATA2, which is phenomenal. And it was just amazing that, all of these organs, vital organs, were spared. And so as we were looking at just everything that happened, the 1 in a million of having GATA2, the rare multiple phenotype acute leukemia, the transit and the delay of cells, that really low survival rate of people who have a relapse in the central nervous system, the fact that graft versus host disease was able to take out the GATA2 cells, but it didn't take out his vital organs, not to mention the 94% leukemia tumor burden from the very get-go, and the fact that we caught it when we did. The true probability of his survival defies many established medical metrics. It's what they would call an N equals 1. It's a sample size of 1. There hasn't been a case study out there of a patient who has had those varieties or those factors.
Right. No literature.
Right. So they're just doing the best they can. They're coming up with all the medical technologies that they can, but there isn't like medical data or research they can look to of standard treatment protocols.
And so it brought us to a really humbling realization. We had the most brilliant doctors, and we're so incredibly grateful for the cutting edge medicine at OHSU and the Ben Cancer Center. But ultimately, medicine can only go so far.
Right, exactly. Medical treatments and amazing doctors can create the perfect conditions for healing. They can deliver the high-dose radiation and the targeted chemotherapy, but ultimately they cannot dictate how a human body will actually respond. It is the body itself, and in our belief, fortified by a lot of prayers, the relentless love of family and friends, and God, that is all part of doing the impossible.
Yeah, science can explain exactly how radiation and Olga's donor cells cleared the leukemia, but it can't explain why every single impossible variable lined up perfectly to save me.
Today, Thomas's brain is healthy and sharp. His memory is fully intact. It's better than mine. His bone marrow is fully engrafted, and he's thriving.
I'm so grateful for the miracles of modern medicine, technology, and the knowledge and skill of my doctors, and the receptivity of my body to treatment. My care team navigated unprecedented situations and made critical care decisions at critical times. I'm also grateful for the miracle of having hope, joy, and peace that transcends understanding, that was rooted in the knowledge that I was not and never will be alone.
Just like in the ER.
Yeah. Just knowing that I'm unconditionally loved and valued by God, as is every single person, regardless of my medical circumstances or outcomes. That gave me the strength and energy to face my day-to-day reality and push forward.
That was well put, Thomas. And transitioning from those hard statistics to where we are today brings us to some of the core messages of this episode.
When you're handed a low survival rate, it feels like staring at a guaranteed defeat, But how you look at the numbers matters. To help you navigate a bleak prognosis, we want to leave you with 4 clear takeaways. Takeaway number 1, don't let the statistics hijack your immune system.
So there's a field called Psychoneuroimmunology, or PNI. And in this study, it looks at how the mind, the nervous system, and the immune system all work together. So when you stare at bad odds, this can trigger that amygdala hijack or that fight or flight response. And if you're just focused on how bad the odds are, you can have the cortisol and stress hormones overwhelming your system. So it's important to really reframe what you're going through. You can say something like, wow, this is really hard. This feels scary. And I'm going to take it one day at a time. Or this is really hard. And I know that my body is designed to heal. And you could say, keep reframing it like, and I have an amazing medical team that's going to be with me every step of the way. So you're really looking at your psychology. You're saying things that are positive. You are saying things not just to make you feel better, but your body, your immune system is really responding. Your neurology is listening to the way that you speak, and that ultimately impacts your immune system.
Yep. Your brain is leading the way. So takeaway number 2 is put yourself in the survivor percentage.
Right.
You have to ask yourself, how do I step out of that threat state and recruit my prefrontal cortex to fight back? And it's just choosing faith over fear, looking at that statistic and seeing, if there's only a 10% survival rate, why couldn't I be in that 10%?
Right. It's human nature. When someone says you have a 10% survival odds, the first thing that the human brain goes to is, you mean there's a 90% chance that I'm going to die? Or it's 50-50. 50% chance I'm not going to make it next year. And we have this negativity bias, and it's adaptive. It's, something our brain does to keep us alive. If there's a saber-toothed tiger chasing us, we don't want to think, well, I might be fine if I walk. Our brains are kind of wired to have a negativity bias, but that ultimately isn't adaptive as we're facing, percentages or prognosis that feels really scary. But I listened to the Blood Cancer United podcast. There was an episode that really changed a lot of things for us. A survivor said, if the survival rate is 10% or fill in the blank percentage, someone has to be in that 10%. And then ask yourself, why wouldn't it be me? So even though maybe your odds were in the single digits, that math doesn't change the mindset. Just ask yourself, or if you have someone who's going through a prognosis that's really hard, just frame it of, well, why wouldn't it be you? Why wouldn't you, or why wouldn't I be that 10%, that 30% that makes it? Just putting yourself in the survival percentage versus the opposite tells your brain that I can do it. I can overcome this. Takeaway number 3, redefine the miracle.
When you're staring at scary math, you have to stop letting statistics dictate your hope, and you have to stop letting them define what a successful miracle does look like.
There's a really beautiful quote from a show called When Calls the Heart. I know it's one of your favorites. It's on Hallmark Channel, so it is not his favorite. But the quote goes, "The miracle isn't that someday all of these horrible things go away. The miracle is that you learn you can handle it." And so for us, the miracle isn't just that Thomas beat all of these statistical odds. The miracle is that we learned through all these hard times to lean on God. We learned how to lean on our family, and we saw the love and camaraderie of our care team and all these people from his work coming around us. We saw the best of humanity, and our faith was strengthened ultimately through all of it, regardless of what the medical outcome was. The miracle is that we were able to navigate it and receive so much love and support from so many people.
Takeaway number 4, normalize the 100% statistic. We spend so much time and energy running from bad medical math, but there's one final statistic that's the ultimate equalizer for every single human being on Earth. I know it sounds bleak, but what is it, Lindsay?
Well, context first would be that I was talking with my counselor, and I had told her in my most recent conversation with Dr. Google, I was recalculating the statistical odds of Thomas's survival. We were up in Portland at the time, and I was just grappling with his prognosis and where things were at based on the relapse of the cancer. And she said, we actually all have, Lindsay, 100% chance of dying. All of us are terminal. And of course we know that, but it was just this powerful conversation. And when she said, every single one of us has a terminal prognosis, we all eventually take that path. And so the ultimate goal isn't for us to avoid death. Ultimately, the goal is deciding on what to do with the time that we have. And although it's kind of like a downer to say 100% chance of death, it's so true. Just
It puts it in perspective.
I think that's the thing about cancer that can be a teacher, and that can be really powerful, is that when you realize that you don't know how much time you have left on this earth, and it could come a lot quicker than you would hope for, it makes you wonder, how am I going to live? When you're faced with death, the goal and that question is, well, then how do I choose to live? So Thomas, can you do the Gandalf quote for us again? It starts with Frodo saying he wishes that the ring had never come to him. He wishes this horrible thing had not happened into his life.
So do all who live to see such times, but that is not for them to decide. All we have to decide is what to do with the time that is given us.
Excellent. Very good. Which has us question, well, what do we want to do? How are we going to use our time on this earth? Looking into our next episode, I believe we're doing the Lord of the Rings Return of the King, wrapping up that series that we had started a while ago, talking about, how do these characters, these beloved characters, and face the possible odds? And from that, how can we look at resilience research? We kind of, infuse that, and we talk about ways in which we can approach a variety of challenges, how we can hold on to hope, and how to find the courage to keep marching forward. So that is probably happening next week.
Thanks so much for listening, and we'll talk with you soon.
Take care.